Hello, I'm Dr. Scott Crawford, Executive Director for the Training and Educational Center for Healthcare Simulation, or TECHS, at TTUHSC El Paso. Thank you for coming to expand your healthcare education with us. We are the first accredited simulation center in the region by the Society for Simulation in Healthcare. We want to briefly orient you to the center so you can get the most out of your learning experience.
Welcome to TECHS, the Training and Educational Center for Healthcare Simulation. We serve all learners on the Texas Tech University Health Sciences Center El Paso campus and healthcare providers in the region from two different locations, TECHS South, which is located in the Medical Education Building on the 3rd floor, and TECHS North, which is located in the School of Nursing Building on the 2nd floor. Both buildings can be found on the corner of Rick Francis and Robert Brown. Here at TECHS South, standardized patient encounters and virtual reality simulators are utilized on a regular basis. Standardized patients, also known as SPs, are individuals who are trained to portray the roles of actual patients, family members, or others, which in turn allows learners to practice physical exam skills, history taking, and communication skills within a controlled and safe environment. SP encounters will usually be done within one of these simulated exam rooms. Each session can be recorded and reviewed to assess learner performance and allow learners to reflect on performance during debriefing to improve care. The rooms are equipped with everything needed for a real patient encounter, including otoscope, ophthalmoscope, and equipment to mimic a real clinic environment. If you are working with standardized patients, we ask that you treat these individuals as real patients, but do not perform invasive examinations or procedures unless specifically instructed to do so as a part of the learning activity. The virtual reality simulators are very sophisticated and allow for basic skills and procedural training in a safe and controlled environment. These systems allow for a wide range of procedural training, from ultrasound imaging to minimally invasive surgical procedures. These training devices are interactive and can guide learners towards mastery performance through technique training and improved hand-eye coordination. In addition, immersive simulation rooms designed to mimic acute care hospital rooms are present at both TECHS North and TECHS South. In these rooms, learners may be exposed to mannequins, standardized patients, or specialty training tools to teach procedural skills called task trainers. Here, learners become proficient in administering medications, performing procedures, problem-solving under pressure, and managing teams and healthcare resources. Many mannequins have advanced capabilities to support learner interaction. These include displaying vital signs, allowing palpation of pulses, performing physical examinations, and allowing vocal interaction to get a patient history. Mannequins will be set up in a room which is equipped with everything needed to evaluate, stabilize, and provide care. Please feel free to open up drawers and use provided equipment to render care, just like in a real patient care setting. If something is not found that you believe is needed to provide care, a phone in the room can be used to contact hospital services, including pharmacy, central supply, or to request consultation. The phone number for consultation will be posted in the room. The overhead monitor in the room can be used to provide clinical information such as labs, radiographic studies, or physical examination findings. If ordering laboratory studies, medications, or radiographic imaging, please write these orders on the whiteboard to allow the technical operators to review and provide these requests. While in the room, there are a few things that you should know. Do not bring food or drink into a simulation room. This is prohibited in both locations. When engaged in a scenario, vital signs will not be shown on the monitor until the pulse ox and monitor leads are placed and secured on the mannequin, just as would happen on a real patient. Do not write on the mannequin nor apply betadine. Ink can transfer from glove to equipment. Please do not write on your gloves. Please be careful when interacting with the mannequin. They are heavy and should not be lifted by a single person, although they can be propped up and limbs can be moved for examination. Please be aware of any wires or cables that are attached to prevent pulling or crimping. Moving parts on hospital beds and gurneys can be a pinch hazard. Use caution to prevent pinching yourself or the mannequin when operating these devices. Please do interact. The simulation environment is a safe place to test your knowledge, and the most impactful learning is acquired through experience. Take advantage of this unique opportunity by coming prepared and engage in the activities provided. Try not to get distracted by the equipment or space. Simulation requires some element of imagination. If there are technical problems with the equipment, this information will be reported via an announcement from the operations staff. If you are using sharps in the room, please be sure to place them in an approved sharps container. If the container is full, notify a member of the TECHS staff immediately, and we will find an alternative disposal location. Never dispose of sharps in the trash can. Both TECHS sites have medication and equipment dispensing systems. These stations provide an opportunity to learn how to retrieve supplies from electronic dispensing stations. There are also fundamental classrooms with multiple clinical beds that can be used for patient assessment, small group learning, and some procedural skills. Each bed is also equipped with functioning headwall systems, and learners are encouraged to interact with these tools to provide care. Additionally, TECHS North has an integrated bed call system that can be used to alert you or other care teams about a need in the room, whether a patient request or a code blue alert. Both facilities have skill stations that are equipped with task trainers, which allow the opportunity to practice procedural techniques such as nasogastric tube insertion, intubation, lumbar punctures, phlebotomy, and many others. We ask that you treat the mannequins, standardized patients, and environment as you would a real clinical environment. This includes arriving on time and wearing clinically appropriate attire for the activity plan, such as business casual clothing, uniform, or clean scrubs with a white coat. And don't forget your stethoscope. Following each session, you'll be asked to provide feedback using a web-based link displayed as a QR code. Please take the time to provide feedback on the encounter and let us at TECHS know what we can do to improve your learning experience.
Thank you for joining us here at TECHS. We hope you enjoyed training with us and look forward to seeing you come back again soon.